Atrial fibrillation is a rapid irregular heartbeat that usually prevents proper blood flow to the body. During atrial fibrillation, the atria of the heart beat chaotically and irregularly, unlike the remaining chambers, ventricles, of the heart. Irregular and rapid heart rate, also known as atrial fibrillation, can lead to poor blood flow. During atrial fibrillation, the heart's atria beat irregularly and outside normal coordination with the ventricles. Although atrial fibrillation itself is not generally life-threatening, it is a medical condition for which emergency medical attention may be necessary. It can lead to complications. Treatments for atrial fibrillation often include medications and other procedures aimed at changing the electrical current in the heart. AF is ordinarily treated with medication or non-invasive approaches, such as heart rate control or changes in lifestyle. AF therapy is designed to stop blood clots from forming, thereby reducing the risk associated with a stroke. Keeping the ventricles' rates of contraction to a minimum enables the ventricles to completely fill with blood. Rate control makes sure that this happens. This method will help the heart continue to function normally, but the person notices improved health. Enable the heartbeat back to a normal rhythm. Rhythm control helps the atria and ventricles again pump blood to the body. Take any optional steps if you have an underlying problem that is exacerbating your AF symptoms, such as hyperthyroidism. Some text goes here: who cares for cardiac arrhythmias? People with no symptoms and no related health concerns may not require services. AF may even return to the normal rhythm on its own, only in a few people who have never had it before. For those who have AF for the very first time, doctors may opt to use electrical therapy or medication to restore heart arrhythmias to a healthy rhythm. Repeated episodes of AF are associated with damage to the heart's electrical system, resulting in permanent or persistent AF in most cases. People with persistent or permanent AF often need treatment to manage their heart rate and control complications. Blood clots may cause a stroke in people with AF. To prevent the formation of a blood clot from spreading from the heart to the brain, doctors prescribe blood thinning medication. Blood thinning medications include warfarin, Coumadin, heparin, and aspirin. Warfarin is the best drug for people with conditions associated with stroke. In case people take warfarin regularly, they must have regular blood tests to monitor the medicine's effectiveness. Doctors additionally prescribe medication to decelerate how fast the ventricles are beating. These medications help bring the rhythm of the heartbeat to a normal level. Persuaded to control their heart rate is the mode of self-care that is best for most individuals with AFib. And even then their hearts don't pump as well as they could. Most individuals with AFib feel better and stop taking their electric devices when their heart rate is controlled. Such medications as beta blockers, such as metoprolol and atenolol, calcium channel blockers, diltiazem and verapamil, and digitalis are available with medications that are used to manage heart rate. Other medications are also offered. Rhythm control physicians are specialists who administer drugs or treatments in an effort to restore and maintain the pace at which the heart beats. This procedure is done especially for individuals who are not obtaining adequate treatment from other kinds of pace-lowering treatment or who are new to having an irregular heartbeat. The AF you have for a longer time, the less likely it is for your heart rhythm to be returned to a normal one. For example, this is particularly likely to happen once your atrial fibrillation has been present for 6 months or more. Another fact is that restoring a normal heart rhythm becomes more difficult if your atria get enlarged or if you are diagnosed with any underlying heart condition. AF is a rare arrhythmia to occur, even when taking medicine to help restore a normal heartbeat. Medications typically used to control a person's heart include amiodarone, sotalol, flecainide, propafenone, dofetilide, abutolide, and occasional other medication. Medicines should be carefully adjusted to the individual taking them because their drug might speed up or slow down an irregular heartbeat, arrhythmia, or can be detrimental to people that have existing heart issues or other diseases. This is particularly true for those who have an atypical heart rhythm condition called Wolff-Parkinson-White syndrome. People can be prescribed AF medicines by injection on a regular basis if they're having AF episodes, or take pills to turn off AF or prevent it from recurring. If the doctor knows how a person will react to a medicine, a specific dose may be prescribed according to the pill in the pocket technique. This means that a patient takes a specific dose of medicine as needed only if he or she has an episode of AF, but not on a regular, daily basis. Matthew, a survivor of cancer and stroke, requests that you help spread awareness of severe diseases by publishing this video. Please take a moment to subscribe to and like this video.